Was that?
When I move the screen to I have three screens. When I put it on the one that I would be looking at.
All right, everyone. Welcome to the Innovators of Health podcast. We are here with with my co-host, Dr. Rahul Desai. Um, Rahul from Portland. He's a physician and in regenerative radiologist specialist. And our guest here today is Dr. Jimmy Huebert. And so, Dr. Jimmy Huebert, welcome to the show. Thank you so much for your time today. And I'm going to start by asking a little bit of background on Rahul because I know you guys have some history there.
Yeah. You want me to go? You're asking me or you're asking Jimmy?
No, I'm asking you, Rahul.
Oh, okay. Well, yeah. I mean, I've known Jimmy for uh, a decade or more. I'll keep this brief. I want Jimmy to talk, but he's been a mentor to me. I think one of the first physicians to help me get into regenerative medicine, which became my career path. I remember reaching out to him early on and asking him some questions on PRP. I was really kind of scared to try it, and he helped me on many fronts, from the medicine to having a private practice, to really integrating a lot of the philosophies of um, the old school prolotherapists, the new school high-end imaging. He kind of covered all the bases, and was really cutting edge. It is cutting edge. So I just learned a ton from him. So that's kind of, and we've maintained a friendship and collegiality, and taught on different stages and other things like that. And he's always been an innovator, someone I've looked up to in the community. And he's also in the same community, so it's nice. So if I need some help, I can just drive over there. It's really easy.
So, so Jimmy, would you like me to call you Jimmy or Dr. Hubert? What would be the best?
Jimmy's fine. It's
Hmm.
either Jimmy or Dr. Jimmy's for most of my patients, so
Or
I'm
Dr.
not
Jimmy?
too formal actually.
Okay, wonderful. So, um, before we jump into the medicine side, what drove you into medicine? Why did you choose this path?
So that's an interesting question I've been asked over the years, and I'll be honest, um, my answer has probably changed a little bit, and I think what I can say is I didn't find it. This found me. So I originally went to residency as internal medicine doctor, and took me about a year to realize I was never going to practice internal medicine. So I thought about getting into interventional cardiology. My second year, I was on we played a lot of basketball in residency, and I was playing with a kid who was doing a sports medicine fellowship.
Hmm.
And that's kind of where the light bulb went off. I had to get permission to do a couple of electives through the Department of Family Medicine since I was internal medicine, but I got permission to do it. I got to hang out with the orthopedic and sports medicine guys and realized this was really cool. And this was something that I thought I wanted to pursue. So I was a little bit late in the game. So after about, I think just started my third year, which kind of the application process is already done for getting into residencies. Um, so I took a year and was trained by five interventional anesthesiologists, pain doctors. They taught me everything from pumps and stims to implantation to epidurals. So I kind of, in a way, got a 1 year pain fellowship, and then I went and did my sports fellowship. And it was amazing how much that year of interventional stuff helped me in my sports medicine fellowship. As a non-surgeon, you were privy to go in on surgeries, but you weren't, you didn't have any of the interventional stuff. And it was interesting to me that those fellows had no idea about injections and spine care and various things. So like I said, it was, whether it was fortuitous or kind of luck or divine intervention, whatever you want to call it, but that kind of found me, and I came out, joined a small orthopedic group out here in Oregon. After a few years, opened my own practice, and been doing it ever since.
That's wonderful. Have you been a sports fan throughout your life?
I grew up in a sports family. So my middle brother played for University of Nebraska for Tom Osborne. I could have walked on there, but I would have had to change positions. So I went to a smaller school, played quarterback, and had a great time. And not that it really was anything in college that I thought I would do, but it was intriguing at the time seeing injuries and how they were treated. And it was just, I don't know if it kind of prepped me for things going forward, but I realized in the back of my head, there's got to be a better way to do this. I mean, how can we speed up recovery? How can we get the guys back playing?
Hmm.
If your star running back goes down, well, that sucks. That's not good for the team. So I think that was kind of where the seed was planted, and then, like I said, the residency and the fellowship and all the experiences since then kind of shaped what I do.
See, you know, when you connect the dots backwards and go from that point to forwards, you can see how that thread, when you talked about this divine sort of thread that chose you, versus you choosing it I can see that, and it's very obvious now how you describe that because you were in a role before, seeing things through those you are designed to serve, and seeing through their lens. And something that I learned about you is that you were a team physician for some very well-known
I
sports teams.
was as a fellow, I got to be. We were. I had nothing to do with it, but the Ravens won the Super Bowl the year I was there, so got that NFL experience. Got to help out with the Baltimore Orioles, so major league experience. We also had at the time, the NFL was adopting the concussion protocol, which was taken from the NHL. So it was kind of a moving target. So there was a lot of things that were being played about what things should we be doing, what kind of testing. So it was, and it's still, there's really not a consensus, but that was a it was a lot of interesting exposures. And yeah, so probably the most fun I had was a little inner city school, Milford Mill High School in Baltimore. And kids were great. I mean, the uniforms, the helmets didn't match. There was no money, but the kids were awesome.
Hey Jimmy, just as you're telling your story, when did you were with an orthopedic group, and also you talked about even in school and along your sports career and medical career, there has to be a better way. Was there any time that was it just a progression of like layer on layer? Was there an epiphany where you said, "Wow, this is the way I want to do things," or how did that change?
So I can still remember to this day the kind of the light bulb moment. So there's a Dr. Crane in Columbia, Missouri, was putting on a PRP course, and I had reviewed a little bit about it. So I was in Oklahoma during my residency, and I got to take a little time. I went to the course, and they were talking about. I think his brother was an ophthalmologist, and they were using PRP for eye injuries and post-surgical repair. But the real benefit of that whole meeting was I got to meet a guy named Thomas Clark, who was using ultrasound to show how to inject an SI joint. And I kind of hung out with him for 2 days. I didn't realize at the time, but he had a company called MSK US, and there were a small group of doctors that were teaching faculty, but they were all like-minded. And from Brian Scheipel in Philly, he taught me about prolotherapy and the theories behind it. So I got to meet some really neat people at that meeting, and that was kind of the spark, realizing that it isn't just surgery and steroid injections and pain medication. There's got to be a better way to try and really and I use the term fix a little loosely because um, if we can get the function back where the people are able to do what they want to do, then to me, that's a very successful result. and whatever that is, whatever kind of tools there are. And that's the cool thing, and Raul can probably attest, but the cool thing about regenerative medicine, and that's kind of a buzzword, people throw around stem cells like that. Not everything is a stem cell, but everybody knows what that means.
Hmm.
Um, it's a constantly evolving, growing field. There's new discoveries and things that can now repair cartilage as opposed to just treat cartilage or injuries or pain or how we process pain. So it's a medicine is one of those fields where you'll never be bored. If you're bored, then you need to retire. And that's probably the coolest thing about what I do and the field that I'm at. It's not really work. It's fun.
Oh, that's amazing. When you don't feel like it's work, what you do, you'll never work again in your life. And you know, you've you've heard that um, across I think I've heard that over the years, for people looking for their passion, for finding what they do and what their purpose is. What do you think is the one of the biggest misconceptions or about regenerative medicine and how people look at the type of medicine that you do? Because from what I understand, there are many people in choosing to do this field because they didn't see traditional medicine as being a fit, and treating things at just a symptomatic level. There have been quite a few arguments there versus going to the root cause. Of where pain or disease. Rahul, you can jump in at any point. I'm just trying to, draw kind of the parallel, but there are misconceptions that people have maybe in your field of regenerative medicine. You just sort of touched on, you talked about just stem cells, but what is that? What would you like someone to know about what you do that usually um, has a vague sort of idea about it?
Well, kind of backtracking a little bit, when I was with the orthopedic group, and uh, I won't say who, but it was always funny that if the surgeries didn't go well, they would ask me to do that voodoo. And I go, what are you talking about? Well, that the sugar water thing or that blood thing. And it's like, come on, you guys, at least, stop calling it voodoo. But what they found and what was interesting is so much of that goes hand in hand with what they were already doing. So, to me, how I think it has evolved is I think people understand more. They're much more educated. There's more access to information. It's real time on the internet. You can now podcast, for example, but you can listen to the leaders in things that are going on. So people will come to you with some really good questions,
Hmm.
um, and and it's nice to have that conversation. And sometimes I end up talking patients out of doing things. It's like that's not necessary. So the way I look at regenerative medicine, and really I look at it as wellness medicine, if you will, because we're really trying to give people the tools to maintain a healthy lifestyle, whether that's checking hormones, what they eat, lean body mass, and there's also obviously the treatments that go with it. So I think you have to look at the whole person, and I think what people are realizing is the traditional medicine model in this country, and you know, um, the healthcare system. You can say what you want about it. It's really designed not to fix people. It's designed to manage people. And I would prefer people come see me once or twice and then they don't have to come see me again unless they injure something else or do something else or have a question. I think the sooner we can use these tools, and I use that as kind of what I tell patients is the sooner we can apply these tools, prevention is going to be so much better than trying to fix something that's, it's already gone. Yeah. And there are things that we can do to help a knee that's been told that, it needs a replacement. But the sooner you can, make some lifestyle changes, some health changes, some things that the better off they're going to be and the less likely that they're going to need these crazy surgeries.
Yeah, Jimmy, when you see a patient and they come in, and I think one of the things that we do too is really like stratification and indication, like where are they at and what disease process they have, and not everything fits into the same box, and that's where I think a lot of patients get a little bit confused, and or even other providers. I mean, I hear in the community, and I don't know if you feel it as much. It's definitely improved a lot, but when we first started doing this, I can't recall when you did that, Jimmy. When did you start your first? Do you recall the year of your first PRP?
I think it's 2003.
2003. Okay, so mine was 5 years later, and even then there was so much like misconception and
Right.
almost anger in the community about us doing this, voodoo type of medicine, and we don't have to. I don't feel it as much currently. I mean, most of the orthopedic practices now actually do, PRP injections. A lot of them are doing both, stem cell injections that incorporated it or at least attempting to incorporate it into their treatment paradigms. But if someone comes in, um, one of the things that I have and I do, and I'd just be interested to see how you're explaining it to folks, is kind of a curative versus, I know people don't like to use that word, but a curative versus a maintenance pathway. So if I see somebody and they have a tendon or ligament issue, you spoke of like getting them functional again, but there's a lot of times where I feel like we can cure it, or the idea is to fix that issue. And if it's not fixed and it's still dysfunctional, then they have to look at another option. Maybe surgery is the right thing. When you're seeing, and then sometimes someone will come in with a severe arthritis of the knee, and that's going to be maintenance. So is that something that, like, how does that conversation go with you? I'd just be interested as a fellow.
So a lot of times most of the time it's about education. Here's, you got a knee, you've seen the orthopedic surgeons, you've had a multitude of cortisone shots, and you can't even walk to go play golf. You have to ride a cart because you can barely move. So what's the goal? What's the end game? Well, doc, I don't want a knee replacement. I've had buddies that have had it and they wish they went to had it. So what are my options? So that's kind of one of the questions, and then it's about how functional do you want to be, how functional can we get you, and then I look at what are the tools that are available. So to me, regenerative medicine, everything from peptides to the stem cells to exosomes, or whatever, they're all tools. And I always try to present options. I always want to, answer questions. I highly, I tell the patients to do a little research. Now, some of them just like, tell me, doc, what's the best thing? And so, nothing's a cure all end all, but to me, the conversation with them is, here's a set of options, here's a set of tools. Now, if they're severely overweight, they got an arthritic knee, there's not much that's going to help them. So then, the first thing that needs to happen is, how do we make you healthier? By whether it's a GLP-1, treatment, or, how can we make you healthier, not skinny, but how do we improve the lean body mass? How do we make you healthier? Because a lot of times, if you make them healthier with better lifestyle choices and more lean body mass, a lot of times that knee or that back is dramatically better without doing anything to it. So, it's, you got to look at, my conversation with the patients is, what's the goal? What can I do to assist you to get to point A to point B? Now, realistically, you may not get to point B, but if we can get you to point halfway through, maybe that's good enough. Or maybe, or we make you healthy enough where maybe you do need the knee replacement, and now your recovery is quite good, as opposed to being overweight and the recovery is terrible. So uh, it's not a one size fits all, I guess, and that's, and Rahul can say, and everything's individualized, everybody's different. Everybody has, their bodies are different, how they respond to things are different. So, um, and there's tools that we expect to work and sometimes they don't, and then you have to look at the other tools that are available. So that's the cool thing about what I do. It's it's never boring, I guess is the easiest way to put it.
No, it's you mentioned peptides, you mentioned exosomes, and I like how you describe them as tools, because they all have a function and a purpose for the purposes of healing. And so, how do you go about, do you have a process by which you stay an innovator and consistently on the cutting edge of your field? How do you think about things? How do you approach that? How do you decide whether this is something needs to be a tool, part of your, repertoire and something that you start to offer your patients?
So probably to me, the most useful and important tool that I have is colleagues like Rahul. I would not be offering red light if it was not for his input. So I have colleagues on the East Coast and West Coast and the guys I teach with, and we share notes. And the coolest thing about doing conferences isn't to teach and isn't to get paid your whatever your travel expenses. I mean, that's kind of a waste of time. You actually lose money when you do that, is to talk to everybody else and see what they're doing. And so, oh, hey, I tried this. What do you think about this? Hey, I use PRFM and it does this for this. And so to me, it's sharing that information so you can either use more tools or to improve the tools that you have to make them work better. And that to me is by far the most important thing is the collegial back and forth of the people that I trust and respect.
Oh, that's wonderful. So since you did mention red light, I'm curious, how are you using red light and in particular, how are you what are your thoughts on red light as part of future of medicine? And are there specific um, areas that you are stacking red light with certain therapies that you're offering and what you're seeing?
So so I put red light in the category of it pretty much applies to everything. It's ultimately safe. It's easy to use. So you have the pillars of a very successful treatment, which is easy to use,
Hmm.
it's cost effective, doesn't take a lot of time, and people get results. So that thing applies to pretty much everything. So we offer it here when we pre-treat or post-treat. We help with recovery. We have a patient that maybe, they don't want to pay for a giant 3 foot panel yet, but they'll come in and it'll be a nominal fee just to be treated here in the office. To me, it's one of those great tools that you know. I'll use a sports analogy where you have that player in football that can play a bunch of different positions, the Swiss Army knife.
Hmm.
Well, the red light is basically a Swiss Army knife. It applies to so many things. It'll enhance so many things, and it can be a standalone therapy as well.
The Jose Kendo of medicine. That's the old school. That
Hmm.
was when I used to watch baseball. I haven't watched it in a long time, but
Yeah, to me, it's a Nassau, whatever in the early '80s or whenever it was that, developed, better health when they were out in space. So it's some neat stuff. It helps with repair, it helps with skin, helps with hair. I mean, who doesn't want better skin and more hair?
Yeah.
Uh, Although Rahul's got a really nice bit there.
So I'm curious. So when it comes to that, when you have a Army knife, there are specific aspects of it that will get results even better or faster, even though they're all holistically improving the body and improving you healing. Can you speak to anything in particular that comes to mind where if you introduced red light to a patient who has a certain type of um, pain or experience that they're coming to you for, that can see results fast, is there something that you're seeing that, hey, I'm using red light and I'm seeing this type of patient, and when I offer this tool or treatment and they adopt it, instantly that is really helping them. I'm
I
really
think
thinking about from a patient standpoint.
Yeah, no, I think the two things that I see pretty rapid results is kind of the people that are systemically inflamed, so joint aches and that, and the other is sleep.
Hmm.
Um, and I don't know exactly what it does, but they all say, "Wow, that's other than maybe a stellate ganglion block or a vagus nerve block for PTSD, that's about as good a non-medication treatment to help with sleep." And in the Northwest, I don't know how much it has to do with the light therapy and the SAD that happens here, you know, seasonal affective disorder, but it's the people, they feel better, and they, whether it's placebo, I mean, Rahul knows a lot more of the research than I do, but it does work, and um, and it's relatively inexpensive, and they can purchase a unit and they do it every day at home. Actually, I got a big panel at home that I use every day. I bought I bought the small panels for all my staff, so that was their Christmas presents.
Yeah, the I got a chance to go to the World Light Congress in Europe, and one of the meetings they had, one of the sessions was about the breadth of treatments that are available and how it affects, when red light, when you get treated, it affects the cells, it affects how the like cell energetics happen, and it affects all the tissues. And so you can treat it. I just read an article on addiction medicine and methadone clinics and using red light, about the same power that we have in our panels, and using it transcranially in the frontal lobes and temporal regions, and dramatic improvements in anxiety, depression, and then like at the same in the same you know realm, you start reading about red light and it's burning fat, right? Abdominal circumference, and these studies that are doing biopsies looking at the tissues and collagen production. And so the concern was that you have something that's treating depression, Parkinson's, and big toe fungus. And how do you like an arthritis and back pain, and it becomes a kind of a snake oil type of deal, and that's what they're really worried about fighting. Is that this is a really powerful medication, medicine, and you can use it in so many different ways to help patients, but it can also be, and the same thing, it reminded me of our discussions, with regenerative medicine, that not all PRP is the same, not all, it's not all made equal, but it can help so many different things. When a patient, or if you have clinicians that are talking to you, Jimmy, how would you kind of approach that discussion? It's like, oh, this is just a bunch of bogus hocus pocus snake oil.
And you still get that. And I don't know if some of that is, I think the surgeons that are more aware of things to improve their outcomes understand that it's a tool. And I never tell them I'm replacing surgery or they don't need surgery, because that's not true. To me, it's an adjunct. It's another way of helping your patients get better. And then Raul touched upon something that was that I fight every day. You'll have patients that'll call. They say, "Hey, so and so does stem cells, but he's only this amount of money. Why are you so much more?" Or what, and if they're going to be price shopping, they're not understanding what they're getting. And what I always say is make sure you understand what they're doing. Ask questions about, are they stem cells from a frozen, vial, or are they stem
Mhm.
cells from your bone marrow or fat? In this country, um, the FDA allows two sources of stem cells, and they have to be from you. So they have to be bone marrow or fat. So we don't use embryonic stem cells unless you're part of a research study. So, when people say, "Oh, they drew blood and I got 8 billion stem cells," like, well, you didn't get stem cells. And I don't know who sold you that, but that's BS. So there's so many stem cell center of XYZ popping up, and it's the Me Too. And unfortunately, Rahul touched on something, that it does give the regenerative medicine a bad name. It does make us look like snake oil salesmen. And And so much, and like I said, so much of my time, and not that I mind, because to me, part of my job is educating the patient on what's the difference. And if they still, you give them the information, ask all the questions, and they're still going to go, down XYZ and have, a PRP treatment done for, a couple $100. And I don't know what percentage it is, but I always have to laugh because universally, if they've talked to me, they will come back a year later and ask me to do what I told them about a year ago. And
Hmm.
after we do the treatment that I recommended, they'll almost universally come back and say, wow, that was a lot different than what XYZ did. It's like, well, yeah. Did they use guidance? Did they, what processes are they using, what tools are they using, are they, it's more than just a shot, so to
Yeah.
speak.
You know,
Yeah.
it's it's interesting because I have a tear in my shoulder, and Rahul, told me to go look at and get it checked out, and I went to um, a practice here in Cincinnati that offers regenerative medicine, and and after they gave me a quote, they did an assessment. I came back, of course, to share it with Rahul, and Rahul he was shocked because if I didn't have Rahul, then I would have most likely had no choice and just kind of walk down that path, without knowing what questions to ask and knowing how to see through some of the fine print that you're talking about.
Right.
But at first had a surgery. Like
Yeah.
the first thing was just
Yeah,
you look.
the first guy said, "Oh, you're gonna have to do surgery." Yeah.
So did you see an orthopedic surgeon?
I did.
Okay, so, and
Yeah.
I apologize to all the surgeons out there. They're wonderful. I got some good friends and colleagues, but a carpenter does carpentry work. And if you go see somebody, they're going to figure out what surgery do you need, because
Hmm.
most of the time that's what they have to offer. Now, some of the more integrated groups that, they are offering some other treatments that aren't just surgery, and obviously
Hmm.
the physical therapist and the rehab and all those things play into it too. But I always and I chuckle, and it's partly tongue in cheek, and I'll have a patient come and say, well, they said I needed surgery. And I said, well, of course, they're surgeons. Well, what do you think they're going to say? And I'm not lumping all of them into that, and they'll probably give me some dirty comments about that comment, but it's true, and vice versa. I'm not going to say that all the things that are not surgical are going to fix it, because honestly, I'm upfront. It's like, you know what, you're going to need to have this fixed. There is no magic bullet to fix this. This
Hmm.
has to be repaired, and then maybe, if to enhance healing or recovery, there may be some things we can do. So and I never say, oh yeah, you'll never need surgery, because that's a flat out lie.
So for
No,
patients who might be
you're,
listening to this,
Jay,
yeah.
you're was the same. I believe it was somebody in the group that you had to, like when we spoke, said go talk to somebody that's non-surgical, physiatry or somebody that's in that group. And then when they went, you got another opinion about, oh, this can be, it's the defect in the rotator cuff, the defect small enough where this can be healed with regenerative therapy, or likely healed, or you have a chance. But that was not even an option.
No, it
That
wasn't
was
an option at all. In fact, what's interesting is that just by reading, ge- um, looking at my MRI, the notes that were part of it and handed to the surgeon were not accurate. And it wasn't until going in to get a second opinion within the same group, to explore another path, did that physician look at it even closer and said, you know what, the the diagnosis is wrong. The way it was being read is wrong because it's not as bad as of a tear because you have so much strength. And if you really had torn it, you would be a little bit more in pain and you would not have the mobility and the strength that you have. So this tells me that you would be a good candidate for something like this because you could use it to start to to heal it. And she showed me on a monitor what she saw and what the discrepancy was in the original reading. And it was just interesting that the surgeon was just went off, that initial read and said, okay, this is what you're going to have to do. Let's figure out when to schedule the surgery. And it wasn't until, and I even brought up PRP at that time. I brought up other options. Hey, what do you think? He said, oh, I can do it for you, but it's not going to work. It'll just be a waste. And that's what he said to me. So he wasn't even ready to explore the option to say, let's see if you are a candidate, and if so, then we can proceed. Otherwise, here's the path. He just flat out, I can do it if you want, but it's not going to work for what you have.
Well, that's, it's interesting because, and Rahul's got even an additional skill that I don't have because he's an interventional radiologist. So, but I always read my own, I always want the films and I always want to look at them. And I'm not saying I'm smarter than radiologists because I absolutely am not, but I like to look at the actual studies. And so I'll bring the patients into my office and I'll show them, here's what I see. And the other thing that I've always told students and residents and people that come hang out is don't treat the picture, and you get an MRI, you got back pain, you got an MRI scan, and you got an annular tear. And guess what? The neurosurgeon says, oh, you need microdiscectomy. Well, no, you don't. Don't treat the picture, treat the patient. And the pain's getting better, my strength is good. It's like, well, you don't need anything. You need time to heal, or maybe some simple things like a supplement or something to enhance that is all you need. So that's interesting that you say that. It's like, he just went by the rating and says, oh, you need surgery. It's like, well, no, examine the patient and don't treat the picture. And that's Raul knows what I'm saying, but
Yeah, I mean, I was just thinking about like, I love energy-based medicine, and you're leveraging it in many ways. We talked about, red light's just one of our energy-based sources that's non-invasive. Jimmy put me on a M-Sculpt machine, which is really it's just supposed to give you abs and burn fat. That's like the indications in the U.S. until recently. And I had hurt I'm trying to get back in shape, and I was lifting, hurt my elbow. It was absolutely killing me, and I was like, "Oh, I'm going to need a PRP injection." Start doing a little red light, and then talk to Jimmy. He's like, "You got to jump on this machine," and I was super impressed. Like I've been hitting it hard with the red light, and also I went over and he showed me the fun. Can you speak to that a little bit? Because I think that's really
yeah.
fascinating.
So it's I don't know if it's a German company, but a lot of
Croatian.
things in Europe are ahead of the United States as far as non-surgical treatments. So
Hmm.
energy treatments, or a lot of times they're labeled alternative treatments, but um, you know, simple doesn't mean not effective. And so BTL is a company that if you look up MSculpt Neo online, you'll see some abs and butts. I think the information has changed a bit. So as of November 1st, they got FDA authorization to use it as a rehab tool, and that's essentially what it is. It uses a magnetic pulse instead of an electrical pulse, and then
Hmm.
RF heat. So it heats the muscle and it will stimulate an actual hypertrophy. So not only do you get more muscle mass, but more importantly, you get more muscle strength. Well, it also works at a cellular level where it improves whether it's the whole milieu is healthy, but I treat people that have had a stroke that have improved function in their leg. Now they don't need an AFO anymore. They got some of the strength back. And so, you can do all the therapy in the world, but if that brain can't make that muscle move, nothing's going to happen. How this machine takes your brain out of it. So, and it's one of the few things, I think red light does a little bit too. It's one of the few treatments that's non-invasive that will actually burn visceral fat, which is the bad fat that plugs the arteries and causes heart disease. This isn't just giving you an 8-pack. This is, getting rid of that unhealthy fat that's around your organs. So, and they just came out um, with a another device to help with brain function. So clarity, PTSD, um, just it's called an exomind, and it's the same thing. It's transcranial magnetic stimulation and improved sleep, and it kind of goes hand in hand with treating the people with PTSD and anxiety
Mm.
disorder, and that's real recalcitrant. And nobody likes taking an antidepressant every day. They have side
Yep.
effects of weight gain and et cetera, et cetera. Some of them, not all. Some of them are absolutely necessary, obviously, but another tools to make you healthier without making it more complicated.
Mm.
So, like I said, I'm a little farm boy from Nebraska, so I'm not smart enough to keep it complicated. So I like to keep it simple.
That is a very strong untruth. Um, so the device I went there. I went to Jimmy's practice and used it. We have it here and we had it upgraded too. But I literally Jimmy put me on a table over there and I fell asleep for 30 minutes. Got the treatment. I woke up and a little bit groggy and went home. And I felt a heck of a lot better. The machines are somewhere $200,000-300,000, so they're not cheap. And I think it's a beautiful adjunct with red light. Because as soon as we did that, then you can go home, and then the red light's cheap enough, easy enough, safe enough where you can have it at home. This device is a medically, you need it in a medical facility, so
Mm.
there's different classifications. And it was interesting too. Before they did that last year, I was looking on if you go to BTL Europe, they actually have a full website and everything on rehab. Like, so anybody, somebody tears their ACL, that machine, they put it on their quads and their musculature and do it's called prehabilitation or like preconditioning and getting them ready for surgery and afterwards. And unfortunately, just because it's not paid for in this country, maybe, that would start to change. But there's so much, after surgery or even after regenerative medicine injection, you have to offload the joint or you have to have, inactivity, and you have all kinds of atrophy and other complications. This is going to help tremendously with that. So it's just it's fascinating, all of these new technologies, and even shockwave therapy is something that is out there. But these energy-based therapies are fascinating, non-invasive. You don't have to put a hole in somebody, and in many cases, it's going to help them heal, not just make them feel better.
100%. I mean, that's the Neo is kind of in the same category as the red light. It's pretty much safe for just about everybody. It's simple to use, it's non-invasive, and it gets results. So we combine them a lot, whether we pre-treat or post-treat with the red light. We have all the setup here in the office.
Mm-hmm.
And the cool thing with that is, short of a pacemaker or some sort of implanted device, this thing applies to all the patients I see right now. So that's the neat thing about therapies is, is it simple? Is it safe? And does it apply to the vast majority of the patients I see? And both of those things do.
Speaking of patients that you see, we're going to get this out there, and I know people are going to be interested in getting help for their own conditions or loved ones, family members. How can they connect with you? What's the easiest way to become a patient or get advice from?
Easiest way is just we have a website and there's a phone number. You can just call the office. We don't have bots, so we're not quite up to the AI stuff yet. So we have a real receptionist, and we're happy to see whoever we need to. And other than little tiny kids and babies, which I don't see, pretty much teenager to 104, I think, is our oldest patient. We have stuff for everybody. So
What's the website?
HuebertSSC.com, www.hubert, Huebert, and the letters SSC, so samcotton.com.
We'll make sure we have your website
Okay.
and links and things in the show notes below. But I know we're coming up on time, so one of my last questions to you, I want to give you the final word on is for anyone listening to this, especially as a patient, what um, what are what pain points, troubles, what are the things that how you want people to think about you when they're experiencing what is that? I'm having joint pain. I'm feeling, what is that feeling? And, and if they are feeling that, that's what you should be, that's what you want to be known for. Um,
Um, that's a good question. That's actually a great question because I don't really know how to answer it. So, um, about half the patients I see is spine related, whether they've had surgery or don't want surgery or need surgery or, chronic back pain, had an injury or, developmental, whatever. And the rest of it is everything from the first responders. So I am Rahul's clinic is similar. We're uniquely positioned in that I don't really fit anywhere. I'm not ortho. I'm not internal medicine. And I say sports medicine, and a lot of times people think I'm a chiropractor, but it's a I think my practice and Dr. Desai's practice are similar in that we are kind of that Swiss Army knife where we'll see everything and we'll give you options. We can't fix everything, but we'll at least give you some very useful information that you can make a good informed decision. And one thing I'll touch on, I am by all means, I'm never offended if somebody wants a second opinion. Um, I think the provider that gets upset that they want a second opinion, they probably answered the question for you
mm.
because by all means, it's like I'm not the smartest guy in the world. There, get more information. If you have questions, I'm happy to research it and find it. So I think it's just I'm a available resource and a tool for anybody that has questions about being healthier and improving their function and pain.
What I'm hearing you say though is if you do have, and let's say spinal, some sort of a back related pain, and it's been persistent. You may, there are some people that have gone places to get it checked out and fixed, maybe gone a couple of treatment paths, have not found success. So perhaps before they lose hope, they should think of you, and really come
Absolutely.
to see another path because it's not, and they may be, those may have been more traditionally well promoted methods, whereas, your method could be another alternative that they don't know about and they should really seek you out. Alternatively, when you're faced with some sort of situation like that, perhaps the another way to think about it is I'm going to go ahead and get two opinions. One in, maybe perhaps this traditional route that may be one way accessible, and then at the same time come see, Dr. Jimmy Hubert and really get to see what you have to say about it, and perhaps that becomes a really good way to understand how to move forward for someone listening to this if they are in some sort of pain or know of somebody who's looking for other methods to seek solutions.
100%. I think think of us and Dr. Desai and myself as resources. Get information is key. And I can't stress that enough.
How
Um,
come you get like three quotes to get your carpet fixed, and then you just get one to get your body fixed? Seems
that's a great question.
Yeah.
And no, it's true. That's I don't know.
Well, I loved how you said, don't treat the picture, treat the patient,
Absolutely.
So, um, so anyways, thank you so much, uh, for being on the show. Thank you for your time and sharing your wisdom and sharing your experience and, Rahul, you as well. And, for listeners of Innovators of Health, really like you to think about not only your own health and but also your loved ones. And if you're other physicians listening to this, this is just another resource for you to listen to great minds and great innovators like Dr. Hubert here and Dr. Desai, and perhaps you can learn something and add some value too. So we're always here. You can check out the show notes below to find out how you can access us and access Dr. Jimmy Hubert. So thank you.
Awesome. Thanks for having me, guys. This was great.